Ladies Wing IMA KSB. Let us start the program by IMA prayer by Dr. Rajni. She's a Women Vice President of IMA KSB. Rajni, over to you.
Thank you, Dr. Padma. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Thank you.
Thank you, Dr. Rajni. Now I invite
Rajni madam, flag salutation.
Madam, flag salutation bearer idare madam.
I invite Dr. Neelamma to do the flag salutation.
Yes, good evening everyone. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯುವಾಗಲಿ.
Thank you, Dr. Neelamma. It's an absolute honor for me on behalf of IMA KSB Ladies Wing to invite and to welcome Dr. Veerbhadraya sir. He is the President IMA KSB. And immense pride to welcome Dr. Surya Raju, Honorary Secretary IMA KSB. And I welcome today's guest speaker. She brings great insight and value for today's session. She is Meera Devendra from Bengaluru, stage 2 breast cancer survivor. Warm welcome to you, Meera Devendra. And of course, to all my teammates, state team of Ladies Wing IMA KSB, past President Dr. Chinnivala sir, and Dr. Sulochana Chilivarna madam. When I invited her, she accepted happily that she will introduce the guest speaker for today's session. And I welcome all the senior doctors who are present here for today's session. Dr. Puma is joined, I think. And all the senior doctors and all the audience. So without wasting much time, now I think I invite Dr. Sulochana Chinivala madam to introduce Meera Devendra, today's guest speaker. Over to you, ma'am.
ಥ್ಯಾಂಕ್ ಯು ಪದ್ಮ. ನನಗೆ ಬಹಳ ಸಂತೋಷ ಅನಿಸ್ತದೆ ಮೇಡಮ್ ಮೀರಾ ನಾಯ್ಡು ಅವರ ಪರಿಚಯ ಮಾಡೋದು. ಏಕೆಂದರೆ ಅನುಭವ ಇರುವಲ್ಲಿ ಅಮೃತತ್ವ ಇದೆ ಎಂದು ಹೇಳಲಾಗುತ್ತದೆ. ಅವರು ಸ್ವತಃ ಕ್ಯಾನ್ಸರ್ ರೋಗದಿಂದ ಹೊರಬಂದು ಜನರಿಗೆ ಅದರಿಂದ ಹೊರಬರುವ ಬಗೆ ಹಾಗೂ ಬದುಕುವ ಬಗೆ ಕಲಿಸುವ ಒಂದು ಕಲೆಯನ್ನು ಕರಗತ ಮಾಡಿಕೊಂಡು ಅದರ ಬಗ್ಗೆ ತರಬೇತಿದಾರರಾಗಿ ಹೊರಹೊಮ್ಮಿದ್ದು ಬಹಳ ಸಂತಸದ ವಿಷಯ. Now I will introduce Meera Naidu madam to this function. Meera Naidu madam is ICF credentialed coach, cancer survivor, cancer and well-being coach. Madam an ICF credentialed associate certified coach with a deep focus on cancer survivorship and well-being. Drawing from lived experience as a cancer survivor and rigorous coach training, she supports individuals, especially women, as they navigate diagnosis, treatment, recovery, and life after cancer. Her work is grounded in presence, compassion, emotional resilience, and sustainable change, aligned with ICF core competencies and ethics. Bringing a calm space to help support the whole person, mind, body, emotions, while supporting clients to reconnect with inner strength, self-trust, and purposeful living. Her coaching credentials and certifications. She is Associate Certified Coach, International Coaching Federation, ICF. Certified Narrative Coach Practitioner, The Moment Institute. Cancer Coaching Program is in progress, Cancer Wellness Institute. Preparing for ICF PCC credentialing exam, which is planned in September-October. Her areas of coaching focus, cancer survivorship and life after treatment. She provide one-on-one coaching sessions aligned with ICF competencies. Hold safe, confidential coaching spaces focused on awareness, clarity, and growth, relevant training and professional development, narrative coaching framework, PCC aligned coaching practice, ethics, presence, active listening, evoking awareness, and facilitating client growth. Ongoing learning in cancer coaching, survivorship, and holistic well-being. She holds bachelor's degree in textile engineering. She is professional membership. She is member of International Coaching Federation, member of ICF Singapore chapter. She is available for online coaching for all global clients also. It gives me immense pleasure to welcome Dr. Meera Naidu Madam for this session and hear her experiences and her training programs as well. Thank you, Madam Padma Prakash, for giving me this opportunity.
Thank you very much, Dr. Sulochana, for the warm introduction that you gave. And I don't qualify as a medical professional.
Okay, Madam. I told you are a bachelor in textile.
Yes.
Thank
I
you,
told
Dr.
her.
Sulochana Chinnivalar, Madam, for a kind introduction of Meera Devendra. I think it's time to listen to the speaker of the day.
Yeah.
Meera Devendra, over to you.
Thank you so much, Dr. Padma. So good evening, everyone on the panel. So before I begin, I would like to convey my heartfelt gratitude to Dr. Puama, Dr. Padma Prakash, Dr. Veerabhadraya, Dr. Suriraju, and to the IMA Ladies Wing for inviting me into this meaningful space. And thank you for honoring lived experience alongside medicine. I'm Meera Devendra. I just come here today to speak about a journey of pain, of failures, and many lessons learned along the way. A journey through illness and through cancer. In many ways, my medical journey began much earlier. In 2018, I was diagnosed with chronic fibromyalgia and monoclonal gammopathy. From that time on, hospitals, tests, long-term monitoring, and living with ongoing uncertainty has become a way of my life, and it continues even today. So when I later received a stage 3 cancer diagnosis in 2022, my life began to change quietly from that moment on. Not dramatically, but very, very deeply. Cancer came with unbearable pain, fear, and long stretches of silence. But life continued. Each day, I still woke up. I still took care of my home and my 4 pets. I held on to simple routines because they helped me stay very grounded when everything else felt uncertain. But what held me most gently and most kindly was nature. We have a huge garden and I love gardening. We have around 2,000 plus plants. And during those times, I would just sit in my garden. I would watch plants grow despite the harsh sun and the uneven rain. And what I realized was the earth taught me this. As I held the earth in my hands, I realized that it does not rush healing, it does not resist change, and it quietly supports life in whatever forms are there on it. I understood and I carried this through months of chemotherapy, very painful surgery, and weeks of radiation. When my body felt fragile, as I had a lot of pain, I just remembered this very simple thing that even the driest of land knows how to bloom again. In those quiet hours, my love for learning and reading deepened. Books became my companions, helping me sit with uncertainty and find meaning in silence. I was not alone in this journey. My husband, Dev, and my children, Vivek and Nikita, were my strongest pillars. Dave ensured I received the best possible medical care and held steady when decisions felt overwhelming. Vivek and Nikita stepped away from their own lives to become my very strong anchors. Their presence reminded me that love itself is a form of medicine. During treatment, I spent a lot of time reading and stitching for terminally ill cancer patients at Karunashraya Hospice in Bangalore, and I still continue to do so. That simple act, which I was doing in a lot of silence, gave me a very deep purpose. Often, as I stitched, I felt as though I was standing on a bridge. On one side was my everyday life, filled with pain, filled with fear, filled with uncertainty. And on the other was the threshold of death that we rarely speak about. And in between, I learned to keep walking very slowly and consciously. From there, a new journey began. Today, as an ICF credential coach, a narrative coach practitioner, and a cancer survivorship coach, I work in the space after treatment, where the question shifts from, will I survive this, to how do I want to live now? What I understand very deeply, and I want to inspire many, many more others, that survivorship and life after cancer is not about returning to who we were before illness. It is just about walking forward very quietly with our scars, a changed identity, and a deeper relationship with life. If there is just one simple message that I can hope to leave you all with this evening, it is just this. Illness may stir the waters of our life, make everything feel very muddy and unsettled. But when we just quietly allow those waters to settle, we often discover a quiet lotus pond beneath. And from that stillness, a deeper path just reveals itself. A path anyone can walk, maybe towards awareness, towards kindness to their own selves, and towards deep fulfillment. And what I can say today as a cancer coach is, when medicine and lived experience walk together, the muddy waters are given time to settle. And from that stillness, hope begins to flow, just like a river finding its way around rocks. Thank you so much. And I'm very grateful for all of you for holding space for my story. It just reminds us of a simple truth that beyond diagnosis and treatment, there is always a human being choosing to live again and again, just one day at a time. Thank you so much, and much gratitude for all of you in this space.
No words to express after listening to you, Meera Devendra. Now I request our Honorable President, Dr. Veerabhadraya, sir.
Madam, thank you very much.
Sir, I didn't tell you because I wanted to listen from you about after speaking to listening to the speaker, sir. So
Yeah.
please, over to you, sir.
Yeah,
Our
it
President.
is a motivating speech from Meera Madam. So she has explained
Very
the
much, Doctor.
experience in a nice manner, and it will be very motivating for other cancer affected patients, and for us also to tell our patients and to motivate them to live longer. Thank you very much, Madam.
Thank you so much, Doctor.
Thank you, Madam, for organizing this event. It's very meaningful in this month, cancer.
Yes, sir. That was on Feb 4th.
Yeah.
Feb 4th, cancer.
Padma Prakash, Madam.
Thank you so much, sir. Thank you.
Thank you so
I
much.
request Dr. Suri Raju to address the gathering. Dr. Surya Raju is a Honorary Secretary, IMA KSB.
Good evening, everyone. Sorry for joining late. I was traveling. That's why I could not join on time. Actually, this February 4th, World Cancer Day was celebrated in big way throughout India. After listening to Meera Madam, very inspiring, motivating speech. No words to say, Madam. I really congratulate you because once upon a time, like when I was young, like when I was in MBBS or college student, cancer was discussed like they used to whisper in the ears. Our cancer and many cancer patients, they never used to come out of the home. Cancer means end of the life those days. Because of the people like Meera, see, cancer survivors inspiring other people. It makes huge difference. Even in spite of so much of advanced treatment, still many people, they don't come forward and take treatment. At different phases these days, advanced treatment like chemotherapy, radiotherapy, immunotherapy, nanotechnology, surgical techniques, almost most of the cancers are curable, like lymphomas, leukemias, cancer prostate. Most of the malignancies are treatable. And nowadays, cancer hospitals are also increasing day by day everywhere. And what I observed, madam, people who survive the cancer, they are more energetic and more enthusiastic and more inspiring. They will understand the meaning of the life better than anyone, I feel. And this is my observation. Anyway, keep inspiring people, madam. And I really appreciate Dr. Padma Prakash for organizing such a very impactful and meaningful event. Thank you. Thank you.
Thank you so
Thank
much.
you so much, Doctor, for your kind words, Doctor. Yeah.
Thank you.
Thank you, Dr. Surya Raju sir, Honorary Secretary, MAKSP, for your kind, meaningful, inspiring words as well. Because President, Secretary are the pillars of the organization. We have a very great, united team. So all the senior doctors, no, including Dr. Chinivala sir, who is present, I think even Dr. Madhusudan Karignur also had invited Yoganand Reddy sir, Lakol sir, Venkatachalapati sir. There are so many senior doctors who keep inspiring the younger generation to get involved in the activities which is proactive and it is like giving back to the society. So in that manner, IMA Ladies Wing KSP, we decided to have it in a different way. In spite of having doctors as a speakers also, the survivors should come out with their experiences. So how they felt and what was like the journey from the diagnosis till the when they come out as survivors, we wanted to listen to. And as I told before, there are no words to express, Meera. And Dr. Anuradha madam is there. She's also one of the senior doctor here. And all my team members, anybody have questions, any doubts, or you want to speak to Meera, please go ahead.
Hi, Dr. Padma. Good evening.
Hi, Dr. Puvamma.
I think
Good
I would
evening,
like
Dr. Puama.
Hi, Doc. Hi, Meera. How are you? Nice to hear you speak. It is really, really encouraging. So I think
Thank
at
you,
this
Doc.
point, yeah, thank you so much for your words. And I think it's truly inspiring that people like you come out through such difficult times and have still such a positive attitude. So I think this is something to all of us doctors out there. We always think of ourselves as doctors, but we never think of ourselves as an individual, as a parent or a brother or a sister or a wife or a husband. I think we need to be, take more care of our health. We see so many of our own breathe-in, come down with so many types of diseases, cardiac, metabolic diseases, and obviously cancer is also one of them. But I think it's also time to talk about our own health, make time for our own health. Patient care is very important, but I think we have to take out time in our days for our mental health, mental well-being,
Yes.
physical health. And I think that is something all of us doctors have to do. Go for our own screening. We talk about screening, we talk about so many things to our patients, but I think most of us put our own health at a background now. And I think, Dr. Padma, you should really take that initiative of to drive doctors to better health.
Definitely, I agree with you, and I second you as well. In spite of our busy schedules as doctors, we at times we neglect taking care of ourselves, whether it is a screening, even getting all our basic investigations done. So, indeed, I really welcome your suggestion, Pooma. So very nice to listen from you, because you said you were in an examination online, but still you gave some time to join us and speak out. There is a message, very inspiring journey, Meera. You yourself have become a beacon of hope for other patients now. Thank you so much, Dr. Anuradha ma'am. Are you heard out? Are any of my team members? Dr. Rajni?
Padma, I'm very
Anybody?
much there.
Please, ma'am, please. We want to
Yeah.
listen.
So, yeah, I request Dr. Pooma to just, what to say, as a breast surgeon, kindly give some message to your colleagues. So, for us, lady doctors, as well as our men doctors are there for their spouses. Kindly give some very important tips, messages, suggestions. Because as you rightly know, you treat more gynecs with breast surgery, breast cancer than compared to other public, in the sense that we are all, lots of us neglect our health. So kindly put in your message.
Yes, ma'am. So I think that's why I just spoke last time, just few minutes back, and I said we think we should take ownership of our own health, not just our patients' health. We as doctors give so much of time to our patients, but I think we don't give even 10% of that time to ourselves, or to even our family members. According to American Oncology, nearly 30 to 40% of cancers are considered lifestyle disorders. So lifestyle. So I'm talking about the stress that we are, hello. So
Yeah, we
the
can hear.
life, yes.
We can
So the
hear.
lifestyle that we all lead, including stress, late nights, including not having any kind of hobbies, not having any time for ourselves, the food that we eat, exercise, the diet. I think these are very, very important for all of us doctors. We have to make time to eat healthy, make time to exercise. I think, if I ask for a hands up of how many people exercise today, I don't know how many hands up I'm going to get. Can we have a hands up of how many people really take the time to exercise every day?
Two hands.
Yes.
No hands up at all. I can see
No.
one, Dr. Anuradha ma'am. Yes, you. Who else?
Me too.
Very good, sir. Dr. Veerabhadraya, sir. Very good. Dr. Shobha Ballari. Yes, very nice. I think, yeah, Dr. Suri Raju. Yes, slowly the hands are going up. But maybe at a next meeting like this, all of us should be putting up our hands, because I think as long as we are healthy, we can work longer, we can take better care of our patients. We are at a better mental space also. I think as doctors, we need to have that calm, and we need to have that time that we can give it to our patients and have time to, even to talk to them. And I think one thing important for all of us doctors to convey this message to our patients, that healthy lifestyles, healthy sleeping habits, healthy eating goes a long way. And also, I think for us to take time out to go for our own preventive checkups, make time and reach out to our own family members. Maybe it's your mother, your mother-in-law, your sisters, your brother, your wife, husband. And I think we should all insist that, we all go for our own preventive health checkups. I had one gynecology friend who once told me that every birthday, she and her friend go for their preventive health checkup, and after that, they go for lunch. And I really thought it was a very wonderful practice, because that's one day which we will never forget. Because what happens is, every time we think that we will go, we keep thinking, I just went recently, but it might have probably been more than 3 years back that you've gone and done your tests. So I think, having that one significant day in a year when we can take out and get our own checkups done and make time for yourself. I think make yourself your priority first. If you can look after yourself, then you can look after the world, your patients included. So I think that's one thing for us women, is obviously the two most important cancers, breast and cervical. Get your pap smears done, get your mammogram done. At least the two most common cancers are, looked at, and go for your preventive checkups, I think. Yes, over to you, ma'am.
Thank you, Dr. Purma, for the very sensible and informative words from you. And Suma Gudi from Ballari says to Meera, ma'am, madam, you had a great wealth in your life, the loving family members. Absolutely right. Because I could feel the pain of joy from Meera's eyes. Tears rolled down when she said the two pillars of her, like during the tough time, was her husband Dev and her children. So I think a few moments, 30 seconds, she was unable to speak. It shows that how the family matters. Yeah, not only joyful moments and difficult times as well. That too, a person gets diagnosed this cancer. So really wonderful words from you, Dr. Sumagudi. Anyone want to? And one more thing, Meera, I would like to know when was the first diagnosis done, and how, like, what motivated you to consult Dr. Puama, and how was your journey with the staff when you were under treatment, and how was the cooperation from the management or from the doctor side, or family members and friends? Just I was very curious to know about this. Will you please narrate us about that?
Sure, doctor. Actually, my journey started in 2018, and I was referred to one doctor after the other. It started with fibromyalgia, and then I was referred to a rheumatologist at Columbatia and Vikram Hospital, and from there I was pushed to there was one hospital in Rajaji Nagar, and there finally he put me and he said, it's all in the mind, and you'll have to go back for psychiatric treatment, because those medicines only will help in calming down the pain, because the pain was intense. And then I came on to another hospital where I got to meet a psychiatrist. And unfortunately, I was put on antipsychotic medications, that is Dulane 30, 3 times a day for 3 weeks. It completely numbed me down, and I was kind of very dead to the world. I felt immense relief with my pain, but I think I just stopped it by myself because I couldn't take that kind of drowsiness anymore. And I faced severe withdrawal symptoms. I went into a deep depression, and I went back to my doctor, who said, "Okay, enough of psychiatric treatment. Let us put you on to a psychologist." And I went to a psychologist months together because I had endured a lot of childhood trauma, a lot of physical, mental, and sexual abuse as a child. And I think very strongly that has triggered all these ailments of fibromyalgia, and ultimately, I think cancer, because stress was a big contributor as far as I was concerned to me getting cancer. And that's how my journey began. And in 2022, I noticed a lump on my left breast, and I kind of waited and watched because I was very prompt, going for my annual checkups. And even slight thing, I would go to the doctor and consult her. I was very prompt as an individual and as taking care of my health. So in 2022, when I noticed a lump, I had no weight loss, I had no loss of appetite, nothing of those. I thought, being ignorant, I thought, okay, I'm reaching menopause. Let me just wait and see, because I also went through a hysterectomy for fibroids in 2016. So I was actually very tired of hospitals and doctors, and it was one continuous thing going to all the hospitals in Bangalore, because I had developed dental issues, I had developed trigger fingers, and I went through very painful steroid injections in my fingers to help with that. So I was really very tired. So when I noticed this lump, I said, okay, let me wait and watch. And in a month, it had gone on to the third stage. And luckily, my general physician, Dr. Kavita from North Bangalore Hospital, she said, you have really neglected yourself and please rush to Dr. Puama at Site Care Hospitals. That's how I went there because I hadn't met Dr. Puama. I was only under observations for my multiple myeloma, the M protein. Every 6 months, I would go and visit the hemato-oncologist, Dr. Hari Menon there. So when I went to Dr. Puama, she immediately said, let us just start treatment immediately. What touched me most deeply was her warmth and her very, very soft natured attitude. Something very rare that I had seen during my journey of going to different hospitals and meeting different doctors, where doctors really had, I'm sorry, I'm just telling you, as an individual and as a patient, many doctors that I experienced had literally no time to sit and talk with the patient. Puama was something very different. The healing came from her energy, and it just made everything so normal. And when I started, the diagnosis was done, the biopsy was done with, went and finished the PET scan, and I started the treatment at the hospital. I think my nature of just being very friendly and very warm, everything came together, and I shared a beautiful experience with the nursing staff, with the administrative, the people there. And it helped me understand and humbled me at so many deep levels. The courtesy, the kindness, the nursing staff especially showed, despite what they're going through on everyday basis, 10 patients calling them for little things. And I truly admire, I think, the nursing fraternity and the backstage people who care, for patients. Even that little, that ward boy and the cleaning people who come there, the grace that they show is tremendous. It's truly very humbling. So that was how my journey started and continued.
Very nice. I think now the audience really should express themselves.
Good evening, everyone. Madam Meera, by narrating your journey, you have given not only to the cancer victims motivation to face it, even you have given lot of lessons for every doctor. You have made it very clear. All of us, we have to see a family member in every patient. I think we have got a better lesson today from you, saying how it matters for you all to come out of such a great pain and your sorrow. We give, without our knowledge, by our sympathetic attitude, we give such a lot positive energy to you all. And I really admire you in spite of all the difficulties you had from your childhood till today. You have taken everything positively and faced it. I really give a hats off to you. And we have to learn a lot from you. And let God help you to be more stronger. And thank you, Dr. Padma, for arranging such a beautiful talk. From where did you manage to bring her? We don't know. She is so beautiful also. We have to learn a lot from you, madam.
Yes.
Meera,
I think
madam,
each one's
really.
unique. I think each one's journey is very unique. But unfortunately, like what I have been reading in my coaching, the philosophy is we tend to have the survivor's brain, and we always tend to focus on the negative, the fear, the regret, the guilt, because we were trained to look for fear and threats outside, right from the Stone Ages. So whenever something good comes in our life and good people come into our life, do good things, we just give them very momentary things. Even our memories focus more on the trauma of the hurting, of the bitterness, than what it focuses on the good things in life.
And
But
I feel when I have been with the cancer patients, it is not the surgery, it is not the diagnosis. It is the chemotherapy and radiotherapy, they dread it. Because
yes,
everybody is very fond of their beautiful hair. Everybody is very fond of their beautiful skin. And they dread about it losing both. I think that is the time all the doctors have to be very empathetic and sympathetic towards them. We have to show a lot of love and care. We have to show them they are wanted. And this only these two feelings will bring them out of everything. It is mind is the maximum it plays in survival. Even a person who is gone other side, Yamaraj will come and say, come, come. They can push the Yamaraj and come out with a mind strength. So that strength has to be given by us doctors, not only medication. I think we have learned a very big lesson, Meera Madam, which is very, very helpful for all of us, I think. Thank you for coming and narrating yourself.
thank you so much, doctor. What I find in the hospital system is when patients are diagnosed, they come with a lot of relatives. I'm not saying in a bad sense, but everyone is worried. Everyone is, the uncertainty around that illness is so big. Unfortunately, we have been influenced very negatively by the media and by celebrities, what they put in the newspapers. So, two things I found is when patients come in, they come with huge amounts of files. And the relatives are constantly searching right from the MRM number to the diagnosis. They are confused and they confuse the doctors. And I also fell in that, confusing the doctors. But I realized that we could prepare a simple patient summary, just one page, talking about our medications, our medical history, and especially the medications that we are allergic to. Like my case, I was allergic to penicillin. Every time I mention that allergic to penicillin and related drugs. Many patients are ignorant and they do not put this, and that causes additional problems. Medically, it causes additional problems. And blood groups. Many do not know their blood groups. If I can be in that space of helping patients prepare the simple patient summary, it makes the whole system very seamless. And the second, what I observed is we women are very conscious about our looks, about our hair. So as soon as, the hair is shaved off and we are without makeup, why should we wear wigs and, wear scarves? We are still beautiful even without our hair and even without our makeup. Why should we, have that kind of thing that everything is gone? I used to inspire patients there because especially during, in the chemo ward, when they would get up and go to the restrooms, their wigs would, be out of place. And that itself would cause them so much of stress. That was one thing I observed. And I tried telling, and they felt very nice when I said, you look very beautiful without all those extra things. Just remove and just see how it feels. That was one thing. And the next thing is before going into the diagnostic rooms or the pet scanning, those pet scans, a lot of us women come with saris and it's terribly uncomfortable. So talking about comfortable clothing, okay, what kind of clothing you need to step inside a pet scan, to go for your pet scan, loose, comfortable. These are all little things. If we could make patients aware of these little things. And the other experience was just before radiotherapy, the technician comes and says, ma'am, it's just a small tattoo. So you're just lying on the, that table, expecting the technician to just put one small needle. And suddenly, when he pokes into the bone, it can be quite shocking. Okay, for those of us who can manage pain and who can keep quiet, what about those like elderly people who have, as it is, they're going through a lot of trauma? So I feel small things like, okay, before they step into the diagnostic rooms, be prepared for these simple things. If we can educate patients and create more awareness around all these things, I think it makes the whole treatment much more manageable, reduce the stress on themselves, and end of it, they can come out much more stronger rather than fighting a battle, losing it, and losing hope after treatment.
Is a message in the message box. A great experience hearing Meera's story. I felt as if I am unreading a biography. Kudos to you, ma'am. Keep going. One of the wonderful Zoom meeting till now. Meera, ma'am, how inspiring your words are. As you fighting expressed nursing care, ward boys, and everybody, it plays a major role in the journey of healing. More strength to you. One more message must say, Meera ma'am, rather than going numb from trauma of your ordeal, on the contrary, you are so articulated. You have managed to talk on behalf of doctors too. More power to you. Such kind words from all of you. I really thank all the women doctors wing, the lady doctors wing of IMA, KSB for actively participating. I think strength is rising now. Neelama, ಏನಾದ್ರು ಕೇಳೋದಿದ್ಯಾ?
ಇಲ್ಲ ಮೇಡಮ್.
Anybody want to join hands?
I would like to add a few things, madam.
Please, sir.
Yeah, very inspiring, madam. Meera, madam, actually, the way you spoke,
Thank you, doctor.
it gives a lot of energy for the cancer survivors and many people who hesitate to come forward and take treatment. Your words is the answer, madam. One thing, as we all celebrated with United by Unique, it is very important for us to be united and strengthen our cancer patients. As I think one of the important thing is, madam, it is a family disease. Why I'm telling family disease? Family support is must.
Yes.
Without family support, financial support, and psychological support, cancer survivors cannot go ahead and take the treatment alone, madam. I personally feel that's why it's called as, I personally feel it is a family disease. And some of the patients, what mistakes they do, madam, my observation, even though they're diagnosed, sometimes they go for shortcuts and move away from the treatment. They are so scared, fearful, and they tell that might be this is not cancer. In other branches and other fields, best treatment is available. And they waste their valuable time and end up in terminal stage. This is my experience, madam. And many cancer survivors, I come across cancer prostate. Many people live 20-30 years even with metastasis. This shows that maybe immunity, destiny, willpower plays key role above the treatment, madam. This is my observation. So cancer survivors are the real motivators and inspirers for they should play a key role in motivating people to take the further treatment. Thank you, madam.
Doctor, may I just add one word? Just a
Yes,
line. Thank you so much, doctor, for your kind words. Like I said, my experience with Dr. Puama has been totally different. If I would just call her a very beautiful and strong lighthouse, showing light on all the ships that were passing through the dark oceans, she's like that for all of us. Why I say is this, her very, very humble nature. If you just see her in the hospitals, she looks like one of us. She doesn't have that kind of attitude and that kind of, I'm very sorry, but as a personal experience, I'm just telling, she's so humble, she's so down to earth. I think she's just one in a million that I have met in my journeys to all the hospitals that I have been. Much gratitude to you, Dr. Puama. You're truly amazing.
Thank you,
Meera,
Meera.
this is exactly icing on the cake. Your words are like, that's what I'm sensing, icing on the cake. So thanks, Dr. Puama, for introducing us such a wonderful speaker for the day. I think some more messages. Meera, ma'am, I'm happy to see that small and specific things are to be taken care for the patients so that they feel assured about whatever treatment they are undertaking against cancer. Definitely agree with that. And anybody else?
Padma, I second Mrs. Meera. with respect to Dr. Poma, so you need to be lucky to have a doctor like her, because it may be the the diagnosis may be so bad, but the way she puts it across to the patients and the way she manages is definitely something very exemplary. We need to understand. We need also to not understand, we also need to learn from Dr. Puoma, because that plays a very important role to a patient. So how the doctor is to the patient, it matters a lot, and she has been doing a wonderful job with respect to patients. And she also finds so many breast tumors being mismanaged. She takes it very coolly, she puts across very nicely. So I second Mrs. Meera. Yes, Dr. Puama, regards and hats off to you.
Thank you, ma'am.
madam.
Thank you, Dr. Anuradha ma'am, for your kind words towards Puoma. Puoma, are you around?
Yes, ma'am. Thank you so much. Thank you, everybody. I think just doing our job. That's it.
Okay, so nice. Anyone from the team want to speak? Put your words across. Dr. Rajeshri from Bangalore. Chinivalar sir. Dr. Veena Bhatt.
Yeah, hello. Can you hear me?
Yeah, tell
I
me,
was
Dr.
muted.
Rajeshri.
Yeah, I'm very happy to hear Mrs. Meera and her journey through her things. Looks like Madam has gone to hospitals very frequently and ultimately for this also. And she's very fortunate to have got Dr. Puoma to be her doctor. And even I know that Madam is like that. In this, I'm extremely impressed, Madam. And I understand from the patient's point of view how it looks like, having a cancer and being treated. I can understand many things from you now. One word I want to put forward here in front of everybody is like how Madam said, not everybody are happy without having hair after that chemotherapy or radiotherapy. Many people, they feel like having wigs. So what I suggest is, we have a tendency in India to grow long hair. When we have to cut it short, please have it packed correctly. And there are associations which take that hair and they make it into wigs, they take it and they give you a certificate also for your contribution. And you imagine your own hair being used for a wig for a patient who is otherwise would have suffered for loss of hair. This is my point to add.
Yes,
And
madam.
I'm really impressed, madam, with what you have told. Like, I mean, I won't be wrong if I say like it was like a movie, I mean, I'm sorry to say that it is not. But I know how terrible it is to go through this. And of course, you have a great family, your daughter, your son, who have left their own life to be with you. That is it, madam. I'm very happy to know that.
Dr. Veena Bhatt ma'am, over to you.
Yeah.
ನಮಸ್ತೆ ಮೇಡಮ್, ನಮಸ್ತೆ. ನಿಮ್ದು ನಿಮ್ಮ ಕ್ಯಾನ್ಸರ್ ಪಯಣದಲ್ಲಿ ನೀವು ಜಯಿಸಿ ಬೇರೆಯವರಿಗೆ ಮಾರ್ಗದರ್ಶನ ಕೊಟ್ಟಿರೋದು ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು. ಹಾಗೆ ನೀವು ಹೇಳಿದ್ರಿ ಕೆಲವು ಎಲ್ಲಾ ಒಂದು ಯಾರು ಕ್ಯಾನ್ಸರ್ ಬಾಧಿತರಾಗಿದ್ದಾರೋ ಅವರೆಲ್ಲ ತಗೊಳ್ಬಹುದಂತ ಸೂಚನೆ ಅಂದ್ರೆ ಅದು ವಿಗ್ ಬಗ್ಗೆ ತಲೆ ಕೆಡಿಸ್ಕೊಳ್ಳದೆ ಇರೋದು. ಹಾಗೇನೆ ನೀವು ನಿಮ್ಮ ಒಂದು ಈ ಪಯಣದಲ್ಲಿ ಬೇರೆಯವರಿಗೆ ಮಾರ್ಗದರ್ಶಿ ಆಗ್ಬಹುದಾದಂತ ಅನ್ನೆಸೆಸರಿ ಕಾಸ್ಮೆಟಿಕ್ಸ್ ಈಗ ಎಲ್ಲರೂ ಇವನ್ ಇನ್ಕ್ಲೂಡಿಂಗ್ ಅವರ್ ಡಾಕ್ಟರ್ಸ್ ವಿ ಆರ್ ಯೂಸಿಂಗ್ ಮೋರ್ ಆಫ್ ಮೈಕ್ರೋ ಪ್ಲಾಸ್ಟಿಕ್ಸ್. ಅದು ಏನು ಕ್ರೀಮ್ಸ್ ಇರಬಹುದು, ವೇರ್ ವಿ ಹ್ಯಾವ್ ಟು ಯೂಸ್ ಇಟ್ ಒಕೇಶನಲಿ, ಬಟ್ ಯೂಸಿಂಗ್ ರೆಗ್ಯುಲರ್ಲಿ ವಾಸ್ ಬಿಕಮಿಂಗ್ ಹ್ಯಾಬಿಟ್. ಪೇಷಂಟ್ಸ್ ಆರ್ ಕಮಿಂಗ್ ವಿತ್ ಆಲ್ ಮೇಕಪ್ ಟು ದ ಹಾಸ್ಪಿಟಲ್ ಆಲ್ಸೋ. HB 6 grams ಇದ್ರೂನು ಲಿಪ್ಸ್ಟಿಕ್ ಏನಂತಾನೆ ಗೊತ್ತಾಗಲ್ಲ. ಸೊ ಇದನ್ನು ಸ್ವಲ್ಪ ಇನ್ಕ್ಲೂಡ್ ಮಾಡಿದ್ರೆ ನಿಮ್ ಟಾಕ್ ಅಲ್ಲಿ it is almost 100% complete, and it is very useful to the society and the cancer survivors. Thank you, madam. Thank you. And thank you,
Doctor.
Dr. Padma, for the opportunity and for introducing Meera madam to the audience. Thank you.
Thank you so much. Thank you, Dr. Veena Bhatt. Anybody else? Dr. Anna Brahma is there. Dr. Anita Chalpati. Really, I want to listen from Dr. Anita.
Yeah, thank you, Padma. Madam, it was very inspiring talk, madam, and everybody has told all their views. So, same from my side, madam. It was very inspiring talk. Thank you, madam. Thank you, Padma, for introducing the speaker.
Thank you, Dr. Anita.
Yeah.
Thank you, Dr. Anita. Dr. Satyavati from Bangalore. Dr. Kaustuba from Shumoga. Idira.
Namaste, madam. Dr. Kaustuba Shumogadinda. Modlike Dr. Meera madam, it was very inspiring. Thank you for making time and speaking to us. The one thing I feel is about the dress which the patient comes to the hospital. I run a diagnostic center up to the lab to give blood. I think, as you told, we need to educate the patients how to visit a doctor. Maybe when we do that, patients also will feel comfortable, and also the the procedures and the lab works will be it will be comfortable to both the parties. And your journey was very inspiring, madam. And as our president Veerabhadraya sir, president sir told, it is the family disease. I completely agree with that, because if one person in the family falls sick, it's it's the onus lies on the whole family to get the patient or the person back to the healthy state. As he rightly told, it's a family disease, and you have been very inspiring, madam. Thank you. And Dr. Padma Prakash ma'am, thanks a lot for introducing Madam Meera to us.
Thank you so much for your kind words, Dr. Kaustuba.
Now I would like to listen from Rahul. Rahul, are you around?
Yes, doctor, very much here. Just a minute. What do you want me to talk about, doctor?
Your views.
I'm sorry?
Your views about this session.
About this discussion? I mean,
yes, about this session, about Meera.
Oh, wonderful. Sure. So first I'll go about the how Meera and I met. Both of us are into coaching, the space of coaching. And when we connected the first time, we were just generally talking, getting to know each other. And then I shared with her that, I had undergone cancer at the age of 18. I had a tumor in the brain. And then we started talking about cancer. What can we do for the space of people who go through it, and post-cancer survival, how difficult it is for some people. And even during the treatment for the caregivers, especially, one person for me, my father was running behind the doctors to collect reports, and mother was behind the insurance company. And Meera had just covered everything so very well articulated, and so, I would say just wonderful to listen to. And something which I also felt was, yes, there should be the way we speak to the particular person undergoing the ordeal, and also to their caregiver. Sometimes that person may just want you to be there besides them, not say a word, but just your physical presence is much more comforting for them. So she covered everything so very well that I was just switched off my camera, ardently listening. And thank you for this wonderful opportunity for me to share what Meera had shared from my perspective as such. And yes, I definitely see so much of courage in Meera. Like, it's not very easy to go through it at an age and so much of responsibilities in life. She had just braved through it all, and whenever I speak to her, she is always very pleasant to talk to. I mean, it just makes my day. I'll just finish work, and Meera will be like, "Can we connect?" I said, "Sure. I can make space for Meera anytime." So thank you, doctor, and looking forward to also having the opportunity to work with you in the future. Thank you so much. Thank you so much, Meera.
Thank you, Rahul.
Thank you so much,
Can I
Rahul.
just
Yeah,
Can I
please go
speak
ahead.
a few words
Yes,
on Rahul, doctor? Just a few words on Rahul.
definitely.
Rahul actually, he's my son's age, 37. He's 37 years now. He was diagnosed with brain tumor at the age of 18, and he was such a lively person. And I think though cancer broke him up into little pieces, he lost his hearing and he had to go through a lot of aggressive treatments. He is a biker and a very cheerful person by nature. And what he's come out from, I think he's hugely inspiring, at least for the younger generation, the male, uh, the male gender or the male people who go through cancer and think that, they have no life beyond cancer. I think Rahul can be hugely inspiring to all those people out there. And it'll be a wonderful opportunity if Doctor, if you could just give him a chance to speak about his own journey and inspire all the youngsters out there who have recently been diagnosed with cancer.
Definitely, Meera. Your suggestion is indeed taken well in a sportive manner. Really nice.
Namaste.
Namaste. Please go ahead.
ಡಾಕ್ಟರ್ ರವೀಂದ್ರ ಮಾತಾಡ್ತಿರೋದು ಬಳ್ಳಾರಿಯಿಂದ. ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಮೇಡಮ್ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ಬೇಕು. ಅವರು ಮಾತಾಡಿದಾಗ ಡಿಸ್ಕಸ್ ಮಾಡಿದಾಗ ಅನ್ಕೊಂಡ್ವಿ, ಒಬ್ಬರು ಡಾಕ್ಟರ್ ಪರ್ಸ್ಪೆಕ್ಟಿವ್ ಇಂದ ಕೇಳೋದಕ್ಕಿಂತನೂ ಒಬ್ಬ ಅನುಭವಿ ವ್ಯಕ್ತಿಯಿಂದ ಕೇಳೋದು ಬಹಳ ಅರ್ಥಗರ್ಭ ಇರ್ತದೆ ಮತ್ತು ಜೀವನಕ್ಕೆ ಹತ್ತಿರವಾಗಿರ್ತದೆ. ನೀವಿಬ್ಬರದು ಮಾತು ಕೇಳಿದಾಗ, ಮೀರಾ ಮೇಡಮ್ ಮತ್ತು ರಾಹುಲ್ ಸರ್ದು ಮಾತು ಕೇಳಿದಾಗ, ನನ್ನ ಮನೆಯಲ್ಲೇ ಒಬ್ರು ಸರ್ವೈವರ್ ಇದ್ದಾರೆ. ಮೇಡಮ್ ಹೇಳ್ದಂಗೆ ಅವರು ನಾನು ಹುಬ್ಳಿಗೆ ಕರ್ಕೊಂಡು ಹೋಗುವಾಗ ಹೇಳ್ತಿದ್ರು, ನನ್ನ ಕೂದಲು ಹೋಗ್ಬಿಟ್ರೆ ನಾನು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳೋದಿಲ್ಲ, ನಾನು ಸತ್ರು ಪರವಾಗಿಲ್ಲ, ನಾನು ಟ್ರೀಟ್ಮೆಂಟ್ ಬೇಡ ಅಂತ. ಅವಾಗ ನಾನಿನ್ನೂ MBBS ಮಾಡ್ತಿದ್ದೆ. ನಾನು ಮೋಸ್ಟ್ಲಿ ಸೆಕೆಂಡ್ ಇಯರ್ MBBS ಇರ್ತಿದ್ದೆ. ದುಡ್ಡಿಂದು ಇಶ್ಯೂ ಇತ್ತು, ಬಟ್ ಅದ್ರ ಜೊತೆಗೆ ಅವ್ರನ್ನ ಎಮೋಷ್ನಲಿ ನಾನು ಹೆಂಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡೋದು ಅಂತ ಅರ್ಥ ಆಗ್ತಿರ್ಲಿಲ್ಲ. ನನ್ಗೆ ವಯಸ್ಸನ್ನು ಚಿಕ್ಕದು, ಆಮೇಲೆ ಅನುಭವನೂ ಇರಲಿಲ್ಲ. ಅವರು ದೊಡ್ಡವರು, ಹಿರಿಯರು. ಆ ತುಮಲತೆ ಏನಿರ್ತದೆ, ಮಾನಸಿಕ ತುಮಲತೆ ಇರ್ತದೆ, ಮತ್ತು ಅವ್ರನ್ನ ನಾವು ಬಲವಂತವಾಗಿ ಆದ್ರೂ ಹೆಂಗೋ ಮಾಡಿ ಕಾಜೋಲ್ ಮಾಡಿ ನಾವು ಅಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡಿಸ್ಬೇಕಂದಾಗ ಡಾಕ್ಟರ್ ಪಾತ್ರ ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿ ಹೋಗ್ತದೆ. ಸ್ವಲ್ಪ ಡಾಕ್ಟರ್ ಸ್ವಲ್ಪ ಕಿರಿಕಿರಿ ಇದ್ದ ಅಥವಾ ಇಂಪೇಷಂಟ್ ಅನಿಸ್ಬಿಟ್ರೆ ಅವರು ಹೋಗ್ತಾನೆ ಇರಲಿಲ್ಲ. ನಾನು ಬೆಂಗಳೂರು ತಿರುಗಾಡಿದೆ, ಅವ್ರನ್ನ ಕರ್ಕೊಂಡು ಹುಬ್ಳಿಗೆ ಹೋದೆ. ಈ ಥರ ಅಂದರೆ ಅವ್ರು ಎಷ್ಟು ಸೆನ್ಸಿಟಿವ್ ಆಗಿರ್ತಾರೆ ಅಂದರೆ, ಲೈಕ್ ಮರಣದಂಡನೆ ವಿಧಿಸ್ಬಿಟ್ಟಿದ್ದಾರೆ ಯಾರೋ ಅನ್ನೋ ಲೆಕ್ಕಕ್ಕೆ. ದೇ ಆರ್ ಅಬೌಟ್ ಟು ಈ ಥರ ಅಂತ, ಅಬೌಟ್ ಟು ಡೈ ಅನ್ನೋ ಲೆಕ್ಕಕ್ಕೆ. ಆಮೇಲೆ ಎಲ್ಲಿವರೆಗೂ ಭಯ ಅಂದರೆ, ನಾನು ಸುಳ್ಳು ಹೇಳ್ತಿದ್ದೆ, ಅದು ಕ್ಯಾನ್ಸರ್ ಆಸ್ಪತ್ರೆ ಅಲ್ಲ, ಬೇರೆ ಏನೋ ಅಂತ ಹೇಳ್ದಾಗ ಬರೋರು ಅವರು. ಅಲ್ಲಿವರೆಗೂ ಭಯ. ಅದರಲ್ಲೇನೋ ನಮ್ಮ ಉತ್ತರ ಕರ್ನಾಟಕದಲ್ಲಿ ಇವತ್ತಿಗೂ ಕುಲ್ಲ ಹೇಳ್ಬೇಕಂದ್ರೆ, ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಇಟ್ ಇಸ್ ಅ ಟ್ಯಾಬು ಅನ್ನೋ ಲೆಕ್ಕಕ್ಕೆ. ಅಯ್ಯಪ್ಪ ಬೇಡ ಬಿಡು, ಅವ್ರು ಮುಟ್ಸೋದೇ ಬೇಡ, ಮಕ್ಕಳನ್ನ ಕೂಡ ಅವ್ರ ಹತ್ರ ಕಳ್ಸೋದಿಲ್ಲ ನಮ್ಮ ಕಡೆ. ಆಮೇಲೆ ಅವ್ರನ್ನ ಒಂದ್ ಕಡೆ ಕೂಡ ಹಾಕ್ಬಿಡೋದು, ಆಮೇಲೆ ಅವ್ರಿಗೆ ತಟ್ಟೆ ಬೇರೆ, ಊಟ ಇದನ್ನ ಮಾಡಿಸೋದು ಬೇರೆ. ಆ ಥರ ಲೆಕ್ಕಕ್ಕೆ ಇವತ್ತಿಗೂ ನಮ್ಮಲ್ಲಿ ಪ್ರಿವೈಲ್ಡ್, ಇಟ್ ಇಸ್ ಸ್ಟಿಲ್ ಪ್ರಿವೈಲ್ಡ್ ಇನ್ ನಾರ್ತ್ ಕರ್ನಾಟಕ ಆ ಥರ. ಬಟ್ ಈ ಥರ ಲೈವ್ಲಿ ಪೀಪಲ್ ನಾವು ಕಂಡು ಬಂದಾಗ, ಮೀರಾ ಮೇಡಮ್ ಇರಲಿ, ಈ ಥರ ರಾಹುಲ್ ಸರ್ ಇರಲಿ, ಇವು ನಿಜವಾಗಿ ನೈಜತೆ ಇರುವಂಥ ವ್ಯಕ್ತಿಗಳು. ಯಾಕಂದ್ರೆ ನೋವುಂಡು ಬಂದಂಥವ್ರು ನೈಜವಾಗಿ ಹೇಳ್ತಿರ್ತಾರೆ. ಅವರು ಯಾವುದೇ ಥರದ ಆರ್ಟಿಕುಲೇಷನ್ ಇರೋದಿಲ್ಲ, ಫ್ಲವರಿ ವರ್ಡ್ಸ್ ಇರೋದಿಲ್ಲ, ಅದು ಯಥಾ ನೋವು ಇರ್ತದೆ. ಅದನ್ನು ನಾನು ವೈಯಕ್ತಿಕವಾಗಿ ಅನುಭವಿಸಿದ್ದೀನಲ್ಲ, ನಾನು ಇವತ್ತು ನನ್ನ ಮನೆಯಲ್ಲಿ ಆ ಫೈಲನ್ನು ಯಾರಿಗೂ ತೋರಿಸಿಲ್ಲ. ನನಗೆ ಆ್ಯಕ್ಚುಲಿ ಈಗ ರಾಹುಲ್ ಸರ್ದು ಕೇಳಿದ್ಮೇಲೆ ಇನ್ನೂ ಸ್ವಲ್ಪ ಕರೇಜ್ ಬಂತು. ಇವತ್ತಿನವರೆಗೂ ನಾನು ಫೈಲ್ ತೋರಿಸಿಲ್ಲ, ಮುಚ್ಚಿಟ್ಕೊಂಡಿದ್ದೀವಿ. ನಾನು ನಮ್ಮ ಬ್ರದರ್ಗೆ ಹೇಳಿದ್ದೀನಿ ಯಾರಿಗೂ ತೋರಿಸೋಂಗಿಲ್ಲ ಅವ್ರು ಇರೋವರೆಗೂ ಅಂತಂದು ಹೇಳಿ. ಅಂದ್ರೆ ಇಷ್ಟೊಂದು ಭಯ ನಾವು ಇವತ್ತಿನವರೆಗೂ ಆ ಥರ. ಬಟ್ ವಾಟ್ ಎವರ್ ಯು ಪೀಪಲ್ ಹ್ಯಾವ್ ಜಸ್ಟ್ shared, it is something I would like that person to get communicated with you so that she can get some kind of energy, some kind of boost to her life. ಆ cheerfulness ಇರಲಿ, ಅದು ಖುಷಿ ಇರಲಿ, ಅದು ಸೊ ಒಂದು ತಾತ್ವಿಕ ನೆಲೆಗಟ್ಟಿನಿಂದ ನೋಡೋದಕ್ಕಿಂತನೂ ಅಥವಾ ಡೆತ್ ಹೆರಾಲ್ಡ್ ಆದ ಕೂಡಲೇ ನಾವು ದೇವರು ದೈವ ಅಂತ ಹೋಗೋದಕ್ಕಿಂತನೂ ನೀವೇನು ನೈಜ ಜೀವನ ಬದುಕ್ತಿದ್ರಲ್ಲ ಅದು ನೋಡಿ ಭಾಳ ಖುಷಿ ಅನಿಸ್ತು ನನ್ಗೆ. ಮೀರಾ ಮೇಡಮ್ ಇರಲಿ, ರಾಹುಲ್ ಸರ್ ಇರಲಿ, ಆಮೇಲೆ ಅವ್ರು ಬೈಕರ್ ಅಂತ ಹೇಳಿದ್ರಿ, ಇದು ಭಾಳ ಖುಷಿ ಅನಿಸ್ತದೆ. ಈ ಥರ ನಿಮ್ಮಂಥವ್ರದ್ದು ಪರಿಚಯ ಭಾಳ ಜನಕ್ಕೆ ಆಗಬೇಕು. ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಮೇಡಮ್ ಮತ್ತು ಪೂವಮ್ಮ ಮೇಡಮ್ ನಿಮ್ಮನ್ನ ಇಲ್ಲಿ ಕರ್ಕೊಂಡು ಬಂದಿದ್ದಕ್ಕೆ ನಮ್ಗೆ ಎಲ್ಲರಿಗೂ ಖುಷಿ. ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ನಾನು ವೈಯಕ್ತಿಕ ಅನುಭವಿಸಿರೋದ್ರಿಂದ ಭಾಳ ಖುಷಿ ಅನಿಸ್ತದೆ. ಸಾಧ್ಯವಾದರೆ ತಮ್ಮ ಸಂಪರ್ಕಗಳನ್ನು ಕೊಟ್ಟರೆ, ಆ ಥರದ ಕೇಸಸ್ ಭಾಳ ಇದ್ದಾವೆ. ಆಮೇಲೆ ಇನ್ನೊಂದು ಆಡಪ್ ಮಾಡ್ಬೇಕಂದ್ರೆ, ಹುಬ್ಬಳ್ಳಿಲಿ ಡಾಕ್ಟರ್ ನಿಟಾಲಿ ಅಂತಂದು ಹೇಳಿ ಸರು ಈ ಎಂಡ್ ಸ್ಟೇಜ್ ಇರೋರಿಗೆ ಅಲ್ಲಿ ಒಂದು ಅಸೋಸಿಯೇಷನ್ ಇಂದ ಒಂದು ಹಾಸ್ಪಿಟಲ್, ಎಲ್ಲಿವರೆಗೂ ನನಗೆ ಅವ್ರು ಮಾಡ್ತಿರೋದು ಒಳ್ಳೆ ಕೆಲಸ. ಬಟ್ ಏನಂದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಆಗೈತೆ ಹಿಂಗೆ ಅಂತ ಅಂದ್ಕೂಡ್ಲೇನೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋಕ್ಕೂ ಆಗಲ್ಲ ಅಂದ್ಕೊಂಡು ಅವ್ರಿಗೆ ಇಂತಿಷ್ಟಂತ ಅದು ಒಂದು ಇದು ಕೊಟ್ಟು ಮಕ್ಕಳು ಅವ್ರ ತಂದೆ ತಾಯಿನ ಬಿಟ್ಟು ಹೋಗ್ಬಿಡ್ತಾರೆ. ಈ ಥರ ಒಂದು ಪರಿಸ್ಥಿತಿ, ಅದು ಬಹಳ ಹೃದಯ ಒಡೆಯುವಂಥ ಒಂದು ಇದು. ಅದು ಆಗೋದಿಲ್ಲ ಬಿಡು ಅಂತ ಅವರು ಕೈ ಬಿಟ್ಬಿಡ್ತಾರೆ. ಬೇಡ ಬಿಡು, ನನ್ನ ಮಕ್ಳಿಗೆ ನಾನು ಯಾಕೆ ಭಾರ ಆಗಲಿ ಅಂತ ಇವರು ಆಗೋದಿಲ್ಲ ಬಿಡು, ಇನ್ನು ಮುಗಿದೋಯ್ತು ಅಂತ ಇವರು. ಸೊ ಇವುಗಳ ಮಧ್ಯ ನೀವು ಈ ಥರದ ಕ್ಯಾರೆಕ್ಟರ್ಸ್, ಮೀರಾ ಮೇಡಮ್ ಇರಲಿ, ಈ ಥರದ್ದು ಒಂದು ನೈಜತೆ ಇರುವಂಥದ್ದು ಹೋರಾಟ ಮಾಡೋವಂಥವ್ರು ಇರ್ತಾರಲ್ಲ, ಈ ಥರದವ್ರು ಬೇಕು. ಅದಕ್ಕೆ ನಿಮ್ಮಿಂದ ಈ ಥರದ್ದು ಹೆಚ್ಚು ವರ್ತವ್ಯಗಳಾಗ್ಲಿ ಮೇಡಮ್, ಹೆಚ್ಚು ಜನರ ಜೊತೆಗೆ ನೀವು ಬೆರೆಯುವಂಥವ್ರಾಗ್ಲಿ, ನಿಮ್ಮಿಂದ ಭಾಳ ಜನಕ್ಕೆ ಜೀವನಕ್ಕೆ ಶಕ್ತಿ ಬರಲಿ ಅಂತ ನಾನು ಬೇಡ್ಕೊತೀನಿ. ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್, ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಕರ್ಕೊಂಡು ಬಂದಿದ್ದಕ್ಕೆ. ಆಮೇಲೆ ಇದು ಒಂದು ತಾಸು ತುಂಬಾ ಖುಷಿ ಅನಿಸ್ತದೆ ನನಗೆ, ತುಂಬಾ ಖುಷಿ ಅನಿಸ್ತದೆ. ವೈಯಕ್ತಿಕ ನಾನು ಅನುಭವಿಸಿದ್ದೀನಲ್ಲ, ನಿಮ್ಗೆ ನಿಜ ಹೇಳ್ತೀನಿ, ಇವತ್ತಿಗೂ ನಾವು ಫೈಲ್ ಓಪನ್ ಮಾಡೇ ಇಲ್ಲ ನಮ್ಮ ಮನೇಲಿ, ಹಂಗೆ ಇಟ್ಕೊಂಡಿದ್ದೀವಿ, ಯಾರಿಗೂ ಹೇಳೋದ ಬೇಡ ಅಂತಂದೇಳಿ. ಇವತ್ತು ನನಗೆ ಸಮಥಿಂಗ್ ಐ ಫೆಲ್ಟ್ ಕರೇಜಿಯಸ್ ಆಫ್ಟರ್ ಲಿಸ್ನಿಂಗ್ ಟು ಯು ಪೀಪಲ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಥ್ಯಾಂಕ್ ಯು.
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಡಾಕ್ಟರ್.
ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್ ರವೀಂದ್ರ. ಯಾಕಂದ್ರೆ ಈಗಲೂ ಇದೇ ತರ ನಡೀತಿದೆ. ಎಷ್ಟೊಂದು ಜನಕ್ಕೆ, ಎಸ್ಪೆಷಲಿ ಹಿರಿಯರಿಗೆ ವಿಷಯ ತಿಳಿಸಿದಾಗ ಅವ್ರ ಎದೆ ಒಡೆದೋಗುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರಲ್ಲ, ಆ ಥರ ಅವರು ತಗೊಳಕ್ಕಾಗಲ್ಲ. ಮಾನಸಿಕವಾಗಿ ಅಥವಾ ಆರ್ಥಿಕವಾಗಿ ತುಂಬಾ ಕಷ್ಟ ಇರುತ್ತೆ. ಸೊ ನೀವು ಹೇಳಿದ್ದು, ನೀವು ಬಂದು ಭಾಗವಹಿಸಿ ನಿಮ್ಮ ಒಪಿನಿಯನ್ಸ್ ಹೇಳಿದ್ದಕ್ಕೆ ತುಂಬಾ ಧನ್ಯವಾದಗಳು ರವೀಂದ್ರ ಅವರೇ. I think it's a time to wind up. Anybody want to speak, or shall we come to the end of the session? I think we'll come to the end of the session. I invite Dr. Jessie from Mangalore. She is also a state ladies wing IMA KSP member, to give vote of thanks. Over to you, Dr. Jessie.
Yeah, respected our President, Dr. Veerabhadraya, Dr. Suri Raju, our Honorable Secretary, and our very loving, beloved Dr. Padma Prakash. You really invent something new and bring it to us, which is very practical, and we are very happy about it. Today, Dr. Puvamma and Madam Meera, you have brought raw truth in front of our eyes regarding the cancer, which is not only good for so many people. We know the reality. ಒಂದು ಸರ್ತಿ ನಾವು ಅದರಲ್ಲಿ ಒಳಗಡೆ ಹೋದ್ಮೇಲೆ then we will know, ನಿಮ್ಮ ಅನುಭವದಿಂದ, what they undergo really. And I think we can also learn a lot and change the attitude towards all the patients and towards all the cancer victims. And I really appreciate Madam taking your time, Meera Madam and Puvamma. I think you are really a doctor. Doctor means not just for the name's sake. You are really a Vaidya. You have really touched people's heart, and we are very happy to have you around us, and we all have to learn a lot. Thanks for your narration, Madam Meera, and also Rahul. I really admire you. You are a biker means it is wonderful, because I also like biking. Now I can't do because of my width is more than my height. So I have given up now biking, and I really admire you going go-getter. Yes, good. And by your talking and narration, you can really, both of you can help so many people, because this is it's a, people just cringe the moment they hear cancer.
Yes.
And
Yes.
today you have brought the beautiful picture out. I think not only we have to give them the treatment, we have to give moral support to them. But that is what is needed. Not only moral support. Then the next, what is next when they have survived? We have to channelize for them, because they are not the same like before the victims, because their immunity is less, their energy is little less. We have to help them and support them also. I think it is a very practically helping everyone session. I am very thankful, and we all, on behalf of KSB Women's Wing and KSB Karnataka, we thank both of you from bottom of our heart, and all the members. I think almost 36 or 40 people have come. It's a very big gathering today. And I think they will take this message, and they will talk about you in their respective associations. Thank you, everybody. Madam, keep doing the same work. We are very happy and proud of you, Madam Padma Prakash.
Thank you, sir.
Thank you, everybody. Good
Thank
night.
you, Doctor. Thank you, Doctor.
At the end of the session, see you all of you next month, second Tuesday, IMA Ladies Wing, IMA KSP. Let us rock. See you all of you next.
Yes.
Right.
Bye-bye. We'll
Doctor.
rock.
Namaste, Do.
Yes.
Namaste. Namaste.
Good night.
Good night.
Good night.
Bye. Good night. Good night.